Hi, I'm Dr. Julie Steinauer, and today I want to talk to you about a topic that's near and dear to my heart, and I absolutely love it. You got a problem? I've got a filter. All right, before we hop into talking about all the filters that I have that can help you out with the various problems that you might be experiencing, let me tell you how you can connect with us. If you're local, give us a call at 618-288-1489. If you're not local, go to our website, visionforlifeworks.com. You can either fill out a questionnaire or you can click on the schedule a consultation button and schedule a time to talk with me directly. Now, literally, I have on my desk a lot of filters. You kind of can't see it because it's a bit hidden here, but I am going to walk you through some of the filters that we utilize and just kind of tell you there's literally about a filter for just about anything you can think of, visually and otherwise. All right, so for instance, this is a nice red filter right here, if you can see that. This filter is one that we utilize for patients who have esotropia. It's a strong stimulant in order to help the brain relax the eyes. I don't have these in any particular order. I just have them totally random. So I'm going to pick them up totally random. You have headaches and migraines frequently? I got a filter for that. You can't really see this one, but it's a combination of red and green. It's a cool filter, but it helps out with migraines and headaches. Traumatic brain injury, I talked about this in another video. Everybody is traumatic brain injured until proven innocent or otherwise, as I always say. And this bluish kind of purpley type of filter is one used for traumatic brain injury. We're just going to keep going down the list. And again, they're not in any order. I didn't alphabetize them or put them by problem or anything. This particular filter, again, you can't really see the color, but it's bluish green. This is the filter we use for patients who have exotropia, where the eyes are turning out. Earlier, when I talked about the reddish one, I was talking about esotropia, where the eyes are turning in. So this filter triggers the muscles to bring the eyes back into alignment. All right, we got one that helps to stabilize and balance out our emotional system. Why is that important for vision? Well, because if that system is off, it's probably going to be affecting our vision too. Here's one that's important and can be utilized for patients who have headaches, hormonal issues, all kinds of things that could be affecting anxiety levels that could deteriorate your vision. Now, I don't treat hormonal issues. That's not what I do because I'm an eye doctor. But if you have something that is bothering you that needs to be kind of altered and see if we can kind of balance it out a little bit, which is going to help you with your vision, we have to do that because we need a better visual system. All right, here's a filter that we use for patients who have nystagmus. This is kind of a greenish blue filter, but it depresses the movement of the eyes if all else fails. We can go to this one right here. This is a filter, this is another one for esotropia. This is a green filter. It triggers the muscles directly to be able to relax the eyes and not cross them as much. This is a motor depressant, another great filter that we utilize for patients who have nystagmus and sometimes who have problems with vision, which is attached to jaw issues, postural problems with head, neck, back, spine, all that stuff is linked together at times. And if you happen to be a jaw clincher, which causes problems with vision and your jaw, this one actually can help relieve that. What else have I got sitting here? Okay, this is one for balancing out the autonomic nervous system that runs your body. There's a sympathetic and a parasympathetic system. They control some processes with your vision that's super important for me to get balanced. It's also really important to balance these things after you've had a traumatic brain injury. I got a filter for that. What else have I got? Okay, I've got a filter that helps speed up brain processing. So if you're like, okay, my son, he talks really slow, or my son takes a long time to think about things before he ever gives an answer, or after, my wife's traumatic brain injury, she processes a lot slower, or somebody has a binocular vision problem. They don't use their two eyes well together. I got a filter for all those things. It's one that coordinates the two hemispheres of the brain better together. It's kind of a purpley kind of a color, purpley and maybe bluish kind of a color mixed together. What about a vertical misalignment of the eyes, either a hypertropia or what's called a hypotropia, where the eye is pointed down? I got a filter for that. Or superior oblique palsy, which is a particular muscle that works on the eyes moving up and down. It's usually associated with what's called a cranial nerve 4 injury or palsy. I got a filter for that. What else have I got? Are you seeing that we've got a lot of filters? Okay. This is just a general overall make you feel better, make your visual system produce better results, detoxify the system, get the gunk out. Lots of things that this particular greeny green filter does. And I apologize. I don't really have time to show you every single one of these colors, but because you can see there's a lot. This particular filter, you have amblyopia. I've got a filter for that. This filter triggers your brain electrically to send the signal better to the amblyopic eye so we can turn it on again and hopefully get you to be non-amblyopic anymore. And by the way, there's no age range that we cannot treat. Literally, I've treated patients in their 80s who are amblyopic with total success. So if someone's telling you, oh, you're over the age of 7, it's too late, not true. And let's see, we'll end it on this one, which is a balancer of emotions and a balancer of, well, let's leave it at that. It balances some emotions, it balances out the neurological system, does a couple of other things, but it's a great filter. You literally can see, oh, and here's one more. All right, so if a person has amblyopia and we are needing to maybe give them something besides that bright yellow filter, this would be one that we could go to that also triggers the brain to help that eye to see better. And so there's gradations of like strengths of filters that we can use to trigger that amblyopic eye to see better. So this is another one in the toolkit. As you can see, if you've got a problem, I literally have a filter for that. There are so many different things that we can treat. And again, let me be clear. We are not treating specific conditions like, well, I don't even show it here, but we actually have a filter. Oh, here, let me show this one. This one helps our patients who have begun to get more OCD, like maybe after traumatic brain injury, and it's impeding their visual system because they can't literally just move on and do what they need to do with their vision because they're so OCD-like. Filter for that. We have a filter for, for anxiety and depression. There's filters for everything. I don't treat those conditions because I'm an eye doctor. But what we do is if we have a problem that is impeding your visual system, we need to try to get some sort of balance, some sort of improvement on it, send you to your doctor who can take care of that either with medication or with the right supplements and changes to your diet, and away we go. Our primary goal is to fix and correct whatever is going on with your vision. But you can see that there are lots of things that go on in the body, with our mind, with lots of things that can be affecting our vision system that we need to address in order to have our best outcome. Now, if you're intrigued by all of these filters that I've gone through and you're like, oh my gosh, you just named, 2 or 3 things or whatever that you have, then you can contact our office. You can call us at 618-288-1489, or you can go to our website at visionforlifeworks.com, fill out either a questionnaire or schedule a consult time directly with me. And as I always say, if you haven't done so, make sure you hit the like button, subscribe to our channel, and if this could benefit someone, please pass it on. Thank you.